welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor, mother, and functional medicine practitioner who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today's episode is about assembling your dream team of birth and baby experts, and my special guest is Kristin Revere. Kristin is the owner of Gold Coast Doulas. She's an experienced birth and postpartum doula in Grand Rapids, Michigan, and she's a passionate advocate for empowering families, as well as a speaker at various events and conferences. She recently launched a new book called Supported, Your Guide to Birth and Baby with her co-author, Alyssa Veneklase. And you can find out more about her and her doula business at goldcoastdoulas.com. Hi, Kristin. Welcome to the show. I'm very excited to have you on today.
Thanks, Dr. Brayton. I'm excited to chat.
So today's topic is assembling your dream team for birth and baby experts. And I want to talk a little bit in the beginning about kind of how you became such an advocate for supporting women in birth and babies.
Yeah, so it was through my own personal journey. I worked in politics during my first pregnancy and had children later in life. And so a lot of the information from my friends who had children much earlier was outdated. So some of their OBs had retired, some classes no longer existed. I didn't know about doulas with my first pregnancy, did hire them with my second, but I started doing research on my own with my busy schedule traveling the state because I had certain wishes for my birth and wanting to have a hospital birth, but unmedicated, wanted to breastfeed right away. So as a type A personality and planner, I read all the books, watched Business of Being Born, all the documentaries, took Lamaze class. I switched providers in pregnancy when I realized the OB that I originally hired wasn't on board with some of my wishes for an unmedicated birth. So I switched hospitals, in fact, and providers to a nurse midwifery group that was supervised by two OBs.
How many weeks pregnant were you when you did that?
I did switch early on. So I was in the second trimester when I switched.
Okay.
Yes. And I worked with a lot of other practitioners, took prenatal yoga class, saw a Webster certified chiropractor all through pregnancy.
And that's the second pregnancy?
My first.
Okay, got it.
So before I knew about doulas, I had a smaller team.
But still quite robust, actually.
Yeah, I mean, compared to probably the average pregnant individual, it might be more planning due to the nature of my personality. But after I experienced bed rest late in pregnancy at 37 weeks, and induction for preeclampsia at 39 weeks, and ended up with very minimal interventions. I still did not use any pain medication for my birth, but had some issues with my daughter's heart rate during the induction and narrowly avoided a cesarean. But my daughter did end up in the NICU for glucose issues, low birth weight. And so my plans for rooming in, breastfeeding were definitely altered for that reason. She was in the NICU for 4 days. So I started pumping right away, but she was given an IV and then enhanced formula and then my pumped milk. And so it was an adjustment, and I needed to bring in both the hospital lactation team, and I hired a lactation consultant to come into my home to help me with my breastfeeding goals.
Okay.
So that's all my first. And there was a nonprofit in my area. I did not know about postpartum doulas that offered volunteers to come in and help a couple hours a week for the first handful of weeks and, hold the baby, give advice, and certainly offer some household support. So I did utilize that service as well. Mom's Bloom is the nonprofit. There are similar nonprofits around the country.
Okay. And then what happened?
And then my kids are 21 months apart. So my midwifery group suggested that I start trying after a year due to, again, being advanced maternal age and trying to avoid preeclampsia. So I, after my daughter was born, got involved in breastfeeding activism. And having worked in politics, I knew a lot of elected officials and brought them into this rally. And there I met birth doulas. And so when I was pregnant with my son, my first call, other than, of course, telling my husband, was to one of the doulas that I met in planning that rally. So I knew, with chances of potentially getting preeclampsia already being treated differently with advanced maternal age, that it was important to assemble an even broader Drayton team of experts. And so I involved not only the doula team, but my same midwifery practice. And we also took Lamaze twice. So as a planner, I still wanted that information. And then did see a functional medicine doctor on top of the Webster certified chiropractor, and swam as often as I could due to advice from my midwife to keep the blood pressure low, and did yoga and meditation, affirmations, read hypnobirthing. Unfortunately, the hypnobirthing instructor was too far of a distance for me to travel to her, but used some of the mindfulness the second time around to help with, again, that fear of blood pressure rising and potentially getting preeclampsia.
And you avoided it the second time around?
Did. And I got to experience labor on my own. My son was 40 weeks and 2 days, a very quick birth. My doulas were barely with me. I made it to the hospital, and by the time I moved from triage to the room, I was pushing. And the midwifery practice I worked with, the midwives had left the practice, so an OB from the practice actually delivered, but a resident came in and my OB ran in just at the end, the last of 3 pushes.
Awesome. And it sounds like it was a physiological birth.
It was, yes. So I did have a couple of hiccups. My son had tongue tie, so I needed to see experts. It was painful to breastfeed, and I needed to get that revised. So I sought lactation support a second time around, and actually struggled with mastitis due to oversupply and sought additional support that way.
Yeah. Okay. And you have 2 children.
2 children and a bonus daughter who just graduated college.
Okay. So you had really a pretty robust birth team for the first one. And then second one, you even knew more about bringing in doula support. And I know now you're a doula, and so you're an advocate for doulas, birth and postpartum. So I don't know if you want to delve a little bit more into about the role of doulas.
Absolutely. So there are many different types of doulas. Doulas are non-medical support in 3 primary ways. That would be emotional support or coaching in the birth doula role. And resources, again, like helping to build that dream team, giving information on support groups, physical therapists, dietitians, whatever the need for our client would be. And then also giving physical support. So as a birth doula, we help with position changes, hip squeezes, counter pressure, and also teach the partner, if the partner wants to be involved, in physical support techniques. And then as postpartum doulas, we offer physical support with newborn care, household tasks, light meal preparation. We offer sibling care. So it varies based on the needs of the families that we work with.
Yeah, it's so powerful to have doula support. I had a birth and a postpartum doula for my pregnancy and birth, and postpartum recovery. And, you know, one thing that I wanted to point out is when you hire a birth doula, ideally it's somewhat in advance. I know you could start interviewing like around second trimester, right? You can start interviewing and meeting with birth doulas. And once you find one that fits and gels with you and feels like a good connection, there can be prenatal visits with your doula, right? They're not just showing up when you start labor.
Absolutely. The earlier you hire a birth doula, the more connected you will be. At Gold Coast, we do have prenatal visits. We offer text and phone support throughout pregnancy. And then, of course, we're there in person for the birth, no matter if it's at a hospital, a birth center, or a home birth.
Mm-hmm. And I know all doulas, because, you are agreeing to be at that person's birth, and birth can be, we don't necessarily know that's going to happen. There's always usually a backup doula. So if there's a conflict, there is still somebody showing up, ideally in the early stages of labor, right? And then staying with you until the other side after the birth.
Correct.
Yeah.
Yes. So, and we usually stay about an hour to an hour and a half after delivery. So we can take photos, help with the first latch if our clients choose to breastfeed, and get things packed up for the hospitals that have a different postpartum room, and support our clients emotionally in that time.
Yes, that's awesome. So when a woman is thinking about the type of pregnancy and birth that she wants to create, how does she know how to assemble this dream team? Like, how does she know which members are a good fit for her, and how to find those individuals in her area?
Yes, great question. So certainly looking at your goals, and would your goal be to have that physical and emotional support in pregnancy and birth? Then a doula would be a great asset, whether you have an OB or a midwife. And I suggest, not only researching doulas, getting referrals from friends or your provider, but also interviewing more than one doula. And my team has bios, so you can read more about their background and experience, but it is a very personal and intimate time. So you want someone that you feel comfortable with in your space. And so making sure that they're a match for you is important in that way. And as an agency owner, I try to do some of that matching, in the initial call with each client, and then pass them along to the doulas that best fit their needs. And then they're able to interview and make decisions from there, whether it's a birth doula or a day or overnight postpartum doula. Interviewing is still important for the postpartum doula role, because they're in your home during recovery, caring for you.
Yes, that's right. And I've never even heard of an overnight doula. Like in my area, New Jersey, we call them night nurses, but night nurses are really about taking care of the baby overnight, which obviously does help mom. But what does an overnight doula do?
Great question. And there is a difference between a night nurse. Newborn care specialists have become a profession and have taken over that night nanny or night nurse term. And that is focused exclusively on newborn care. But the postpartum doulas who are trained in infant care and overnight support, like my team is, would help the entire family get rest. So if the mother is breastfeeding, for example, we can bring the baby to her or have her come into the nursery. We can help with the latch and give her encouragement, but then we're doing all of the sleep shaping and diaper changes, burping, and she's able to optimize her rest even if she chooses to breastfeed. And obviously with formula feed, there's the family sleeping all night with the formula fed baby. And so it is a bit different of a role where we are still mothering the mother, but also providing newborn care and rest for the family, where again, that night nanny is only caring for the baby.
Right. Exactly. Okay. Because I was like, yeah, that's what doulas do, is they take care of the mother. But you're saying they're taking care of the mother by allowing her to sleep more, even as a breastfed mom who has to wake up in the middle of the night to feed the baby.
Right. And some doula scope does not include overnight care. They don't have the additional infant care training. They're more focused on recovery and daytime support. So that is also, if you're seeking overnight care, you want a doula who has additional newborn training.
Okay. So checking someone's bio to confirm, if they have that certification.
Yes.
Okay. Got it. And it is true. A lot of postpartum doulas have some basic lactation training. They may not be like a full IBCLC, but they can definitely help with latch and identify red flags. And then for more complicated cases, refer out to an IBCLC.
Exactly.
Yeah.
Yeah, and some of the postpartum doulas on my team are certified lactation consultants in addition, or newborn care specialists. I have RNs on my team, but they do not practice as a nurse when they're in the postpartum doula or birth doula role.
Oh, interesting. So they have that nursing degree, but they're working as a doula, which, like you said, is a non-medical role.
And a lot of them still work in the hospital a couple days a week or in an office, and then do doula work in addition.
Mm-hmm. Okay. And so besides doulas, what else would a woman be looking for her dream team?
So looking at priorities in my book, Supported Your Guide to Birth and Baby, I compare it to planning a wedding or other major life occurrences like building a home. So if sleep is a priority, then certainly considering a sleep consultant when baby's older, like I wouldn't suggest that until 3 months or beyond, or certainly looking into a newborn care specialist or an overnight doula. And if similar to a wedding, if food is a priority and nourishment, not only in pregnancy, but in the postnatal time, really being intentional about warming and healing food. And so I'm a fan of the book, The First 40 Days, and some of those traditional methods of healing through nutrition. And so seeking a nutritionist or dietitian, instead of getting a standard meal train, look at specific healing recipes when friends are gifting food, or there are many customized postpartum meal delivery services where you can get meals that will help you in that healing process. Or like myself, needing to make sure that I wasn't deficient in any minerals or nutrients during pregnancy to prevent preeclampsia. So it would be important in pregnancy as well.
Right. Oh, yeah. Nutrition is so important. And, I think it's even empowering that you shared your own story of, if you've had preeclampsia as a pregnant woman, it doesn't mean you have to have it for future pregnancies, right?
Right.
And it really is lifestyle controlled.
Absolutely.
Yeah.
And there's more and more research done on it. And so now they're saying taking a baby aspirin can prevent preeclampsia, where that was not anything that was researched during both of my pregnancies.
Mm-hmm. Yeah, I think what I'm hearing is you practice a lot more stress management tools during the second pregnancy. And we just can't underestimate how much emotional stress impacts our physical body.
Absolutely. Mindset is everything. That's why I love hypnobirthing, because it's mind-body focused, and considering, breath work and the importance of that, and partner support, and understanding what your body is doing in every stage of labor to better adapt. And instead of clenching your jaw and tightening areas during labor, to just relax and view labor as a natural progression, like a wave would be. So instead of resisting, the perception of pain can be minimized using some relaxation techniques, and also understanding what your body's doing and why.
Yeah, that's awesome. And it's funny because as you were talking about, the hypnobirthing practitioner wasn't local to you during your pregnancies, but nowadays people can do virtual sessions, right? I was like, your pregnancies were probably Zoom calls, right? But nowadays there is ways to connect and have access to these resources. I hired a private hypnotherapist during my pregnancy to do in-person sessions. But once again, if you're in a remote area and there's no hypnobirthing or hypnotherapists local, then, there's these virtual options nowadays, which is great.
Yes, and we teach virtual private hypnobirthing classes, so anyone can work with our educator as well.
And do you offer private as well, or is it just group?
We switched from group with private as an option to exclusively private, to be able to accommodate individual client needs and student needs. So it has worked out better in that way, that everyone's got unique needs. If they're planning a cesarean, for example, and want to use the hypnobirthing techniques to reduce their fear, then that's a different need from a home birthing couple who is preparing using hypnobirthing.
That's right. So it makes perfect sense to do the individual private sessions because, to your point, that specific birth is unique to that woman. And it could even be different than a previous birth or a future birth, right? So it's just really preparing for what's to come in the next, few months, right? Like it's around the corner. I'm assuming those are recommended during the second and third trimester. When does a woman start those sessions?
Correct. With the out-of-hospital childbirth classes, whether it's hypnobirthing, gentle birth, Lamaze, it is better to take in the second trimester or early third. To be able to practice some of the different techniques you learn in class and to avoid it coming too close to your due date where you're feeling uncomfortable, or if you deliver early, you miss a class or two is also a fear.
Right, that makes sense. And so these are classes that you offer on your website?
Yes.
Okay, where is that?
So our website is goldcoastdoulas.com, and we offer hypnobirthing. There is also, I teach a comfort measures for labor class that tends to be better in person in Michigan, but I do have a virtual component because during the pandemic, we had to pivot to teaching everything on Zoom live. So I got used to teaching the comfort measures with couples virtually, but it is better to offer hands-on support in the class. We have a multiples class that is virtual and baby registry consultations. Our sleep support is fully virtual, and we have a modern grandparents class. So if you want to get your grandparents up to speed on understanding all of the options, keeping up with safe sleep, and certainly car seats and all the changes with car seat safety, and understanding a lot of the differences in newborn care, including feeding, since they had children. And also we introduce them to all the different types of doulas, and that can be virtual or in person.
I mean, I've never heard of a modern grandparent class, but that's brilliant because things do change and evolve, and it's interesting, like if you'll hear, a mother-in-law, let's say, be like, well, I didn't do it that way. It's like, well, that was 40 years ago. You know what I mean? Like to expect, things to stay the same like that is just silly. So I think it's great. And it's also nice that it's objective. It's not coming from the couple themselves, right? Or, potentially the daughter-in-law, right? She's having to advocate so much from herself as opposed to this is just, what we're doing nowadays. Welcome to 2025.
We take some of the uncomfortable situations with those conversations away and inform the grandparents. And we're in a childcare crisis, as you know, right now. Mm-hmm. And so a lot of grandparents are having to be the caregivers or choosing to be, depending. And so they need to get up to speed if they are caring for their grandchild or children during the day when the parents are back to work.
Right. Yeah. And it's beautiful when grandparents are able to do that, but it is important that they know how to do that as the best as possible.
Exactly.
All right. So you also had mentioned Webster certified chiropractor. I happen to be one of those. So I know when people are looking for one of those, I recommend the ICPA website, ICPA4kids.com, to find a Webster certified chiropractor in their area. And you can see that chiropractor the entire pregnancy, first, second, third trimester, as well as postpartum. And a lot of ICPA docs also see peds, including myself. So doing infant chiropractic, which is so helpful for breastfeeding challenges, digestive issues, sleep challenges. Did your kids get adjusted after they were born?
They sure did. And it helped with feeding issues. My daughter came from the NICU, had some colic. And so I'm a big fan of pediatric chiropractors. And I started very early in both of my pregnancies getting adjusted, and it made a big physical difference. It helped with positioning, and I like to credit some of the quick second birth, and even my induction was pretty quick as far as number of hours. And so to that care from my chiropractic team.
There's no doubt. We say, like, chiropractic adjustments on a pregnant body is really about aligning the pelvis, which becomes the birth canal during birth. And when the tailbone sacrum is in alignment and the uterus attaches to the front of that sacrum, that will directly impact baby's position. So getting both baby and birth canal lined up when that woman's body goes into labor, we see more ease with the birth process, and there's less baby getting stuck. Things progress more effectively and efficiently, and, therefore requiring less interventions. So certainly anyone who's looking to have a physiological birth, which means non-medicated, vaginal delivery, chiropractic care during the pregnancy is a no-brainer. And you don't have to wait till the end. Like, I have some women calling me 36 weeks saying, oh, I want to come in and get my pelvis aligned for the birth. Well, great. 1 or 2 adjustments before birth will help. But if I saw that woman, weekly for at least the 3rd trimester, but even 2nd trimester, and if she was symptomatic, 1st and 2nd, having like morning sickness, nausea, all those other symptoms that are common, chiropractic adjustments can help with that too. So there's a lot of support that can be provided that's beyond either pain relief or, aligning baby and pelvis.
Right. And yes, there are those clients that I will send to a chiropractor who are worried about a breech baby and want to flip baby, or are expecting multiples and want them to all be head down. And so, but certainly I encourage my clients to go as early in pregnancy as possible.
Yep. I also love the idea of a personal trainer or fitness professional who's trained working with a pregnant and postpartum body, because staying strong and fit is so helpful. I mean, even doing some of that work pre-conception, right? Getting your body really in a good shape before the pregnancy occurs is optimal. Doing functional medicine, detox, cleansing, preconception, right? I mean, I would throw preconception support into this birth team, because it's really, that's where everything starts. Getting your body physically, mentally, emotionally, spiritually in its best place before you get pregnant, and then just maintaining that during the pregnancy is going to create a healthier baby and an empowered birth experience.
I am all for that preparation. So if you are in the early planning stages, to get your body and your mind ready and focus on nutrition and care early on, so you have the stamina and you're able to ideally conceive earlier. And there are all of these fertility related benefits now that cover doula support. So as you're looking at, say, chiropractic care, which may or may not be covered by insurance depending on the chiropractor, you can use health savings and flex spending or add it to a registry. And then similar with doulas, we now have these fertility self-funded benefits like Carrot and Progeny and Maven that include not only a birth doula, but also day and overnight postpartum support. And for Carrot, it's the first 6 weeks. You could have a different day and a different overnight doula for 6 weeks, every day of the week, depending on how much of your benefit is left over. So it's fantastic.
That's fantastic. I'm very familiar with HSA, FSA. I accept that in my practice. What is Carrot? I have not heard of that.
So I have found in the last couple of years that Carrot has been one of the main insurance benefit plans for tech companies. So, and
is this in lieu of a private insurance, or is this a supplement?
It's a supplement to a wellness plan from an employer, but I have a lot of clients that tend to work remote for tech companies or banks that have that particular benefit. So say a Salesforce or LinkedIn or Meta would be an example. Clients that could have either Progeny or Carrot as a benefit.
I see. And so it is kind of filling in the gaps that traditional insurance do not cover, like paying for doulas, for example.
Yes, or paying for fertility treatments. Some of them include surrogacy. It's wrapped around. But does include not only a birth doula, but a postpartum doula. So that has been a great way for our clients to save their HSA and their FSA for other birth and baby dream team members, and then utilize some of these benefits for their doula.
And how do you access those benefits? If you have them, do you have to like submit a super bill?
So the client would get reimbursed, and we go through a process where we show our certification and upload documents depending on which program our client has. And then we itemize a bill, so similar to like the super bill, and send that with the hours and doula information that's worked.
And the client pays out of pocket and then they get reimbursed.
Correct.
With that documentation. Okay, that makes sense. That's very cool. Well, Kristin, this has been such a fascinating conversation. Are there any last thoughts you want to share with the audience?
So I would say, look at all of the options for support. And don't be afraid to ask for help. We are super women, but we don't have to do this alone, especially in the postnatal phase. Hiring a doula should not just be for the celebrities or the upper class. If you budget appropriately, or look into your benefits and resources, or register.
Registry. I mean, I want to emphasize that, even when I gave birth, almost 8 years ago, I don't really know if that was much of a thing to register for services, but now it is. Like, you can register instead of, more baby clothes that you're never going to even need. They're going to outgrow in a couple months, things that are really much more important, like these types of services that you want your friends and family to help you fund.
Exactly. Yeah, it is so important. And there are now nesting parties are trending, where family members and friends are coming into the home and helping with some of that postnatal preparation and getting the nursery set up, or preparing meals based on recipes that are important to the mother.
I love it. And for more information too, people can check out your book, Supported, Your Guide to Birth and Baby. And that really speaks to the topic we are on today, right? Is how, as a mom, pregnant or postpartum, can you feel fully supported by your village and get your needs met?
Exactly.
Well, Kristin, thank you so much for coming on the show today.
Thanks, Dr. Brayton. I appreciate it.
Well, I hope you enjoyed today's episode with Kristin. She is a wealth of knowledge and information about everything preparing for birth and postpartum as a birth and postpartum doula. And I think that the more information that women can get during their pregnancy and preparation for an empowered birth and an empowered motherhood on the other side, I think the better. Her resource book, Supported, Your Guide to Birth and Baby, is excellent. I've been able to read through most of it, and it is just a wealth of knowledge and information. And it's nice to have a hard copy in your hand to reference throughout the process. If you want to learn more about the book, you can check it out at supportedbook.com. And to get more information about working with her doula business, as well as her online programs, you can check out goldcoastdoulas.com.